Today you're going to learn how a patient cleared up her eczema and chronic fatigue by getting to the root cause of her inflammation and healing her gut. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And I've been blessed to have seen over 100,000 patient visits over the last 38 years, many of whom have gut and thyroid issues. And this patient was no exception, as she came in, 38-year-old woman, complaining of constant abdominal pain, bloating, gas, diarrhea, eczema, rosacea, insomnia, neck and back pain, brain fog, and chronic fatigue for the past 12 years. For 2 of those years, she said she stays in bed most of the day. She can work up to an hour a day on the computer, and after that, she's exhausted. Severe PMS and menstrual cramps. So after doing comprehensive testing, I put her on an anti-inflammatory diet and the proper supplements. And after a month's time, I saw her again and she said her eczema was better. She had more energy. She didn't have to stay in bed all day. She could now work 3 hours on the computer without getting tired. She had more mental clarity. Her gut issues were better. The bloating, gas, abdominal pain were better. She was sleeping better and had less PMS and anxiety. And at this 1 month point, her labs indicated that her CRP inflammation marker reduced from 4.6 to 0.5, an improvement of 89%. Her low cortisol improved by 119%. Her IGF-1, which is related to growth hormone, improved 72%. So let me show you how we did that. Number 1, you want to get the proper testing. Your doctor typically runs CBC, comprehensive metabolic panel, lipid panel, and TSH. And you also want to make sure you get ferritin and iron panel, CRP, LDH, GGT, insulin, A1C, uric acid, free T3, free T4, and then autoimmune ANA, TPO, thyroglobulin antibodies for autoimmune markers, reverse T3, DHA, cortisol, and hormones, certain nutrients, and urinalysis. So this would be the minimum to find out what is going on with you. And for further root cause functional testing, I like to look at deficiencies, toxins, infections, hormonal imbalance, and food reactions. In her case, she had high CRP, above optimal insulin levels, above optimal ferritin, TSH, which is for thyroid, which indicates below optimal thyroid function, low cortisol, and IGF-1, which is representative of growth hormone. So if you just look at this, what stands out is high inflammation. So eczema is a result of inflammation. The medical treatment for eczema are steroid creams, oral prednisone, which is a steroid, injectable medication. The common theme for all 3 of those is they reduce inflammation. So you could use medications to dampen the inflammation, or you could find out what's driving the inflammation. Inflammation not only causes skin reactions like eczema, but also pain, arthritis, cancer, heart disease. Almost all chronic diseases are related to inflammation. So eliminate that. So not only your skin gets better, you can reduce and prevent all these other issues from happening. So as far as root causes for the inflammation, that's when we look at the functional test. She had deficiencies or low levels of glutamine, vitamin A, some of the B vitamins, C, omega-3, EPA, vitamin D. All those are very important for skin health, proper energy, inflammation, immune function. And under toxins, she had very high levels of mercury. Infections, she had candida, yeast overgrowth. She had gluten sensitivity, leaky gut, which results in many other food sensitivities. So she was sensitive to many different grains, dairy, eggs, legumes, seeds. She didn't have allergies like many people with eczema. She did have sensitivities, which is more of a delayed reaction. Under hormonal imbalance, she had below optimal thyroid and adrenal function, both of which are commonly associated with chronic fatigue, and low adrenal function can result in high inflammation. So step 1 is proper testing to determine root causes, and step 2 is an anti-inflammatory diet. I call it the free diet. It's a diet that I came up with years ago when I was dealing with my own autoimmune Hashimoto's thyroid condition, rheumatoid arthritis, IBS, fatigue, skin, and other issues. So I was able to figure out through trial and error how to get better. And the diet is not only free of gluten, which I was sensitive to, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. So I put her on that, and it's basically for breakfast, it's a smoothie that's high in protein, essential fats, fruits and vegetables, and fiber. If you'd like the recipe for that, I'll put a link below along with a copy of the Free Diet Phase 1 food chart. And for lunch and dinner, it's good quality meat, chicken, fish, plenty of vegetables, and healthy fats. And that is phase 1 of the diet. And as you improve and get into phase 2 and 3, you start adding additional foods back in to see how you do with those. And step 3 are the proper supplements. That includes the functional 5, which are the foundational 5 nutrients that I find most everyone needs. And that includes multi-fish oil, vitamin D with K, magnesium, and probiotic. And for her, I used gut support supplements, including GI Man, Candida Solve Gastric Zyme, and for inflammatory support, curcumin Protect, cardiometabolics, resveratrol and quercetin, and then adrenal vibrance for adrenal support. And then nutrients she was low in: vitamin A, C, E, very important for skin health, B complex, glutathione with NAC, and then metal cleanse to support her because of her very high mercury levels. So with the free diet and proper supplements, she was able to clear up her eczema and chronic fatigue, heal her gut, reduce her inflammation by 89%, and start to enjoy her life again. So the body has an amazing ability to heal itself. If you find out your root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a link for the Free Diet Phase 1 food chart below. Go ahead and like and subscribe so we can get this information out to more people. And I look forward to seeing you next time.